Good morning, everyone. Brand new edition of Sports Medicine Weekly on this Saturday morning. Thanks so much for being with us. My name is Steve Cashel, joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls and one of the co-team physicians with the White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. Our producer, Shane Reardon. Our coordinating producer is Tracy Toro. How are you, Dr. Cole?
I'm doing great. Steve, it's good to see you this morning.
Absolutely. Well, let's talk about some NBA stuff, all right? I want to kick this off. You're one of the head team doctors for an NBA team, the head team doctor for the Chicago Bulls. Chris Dunn injuring his right knee a couple weeks back, and this confirmed the initial diagnosis of a medial collateral ligament sprain. Let me couple that with Kyrie Irving suffering an MCL sprain. And my question for you is, we've talked about this in the past, but again, people are asking me, boy, how close, was Kyrie? And again, you didn't examine him, but, in a typical situation, an MCL sprain and a torn ACL, how close are they?
Well, I mean, they're fundamentally different. And I remember back when I was a sports fellow at the University of Pittsburgh, I had to write a review paper on the biology of the medial collateral ligament versus the biology of the ACL. And they're totally different in how they behave and where they live in the knee. I think the important thing, though, is that like any injury, we've talked about this in the past, say for ACL injuries, people say, well, he had an ACL injury, when's he going to get back? It is important to know that an individual had an ACL injury, but it's also important to know what other structures are involved. So, the knee has a dozen other important structures that can lead to changes in how we rehab and in the outcomes and what might be required for surgery and so forth. So, but when speaking in isolation, if you sprain your ACL or you sprain your MCL, medial collateral ligament, they're very different. The anterior cruciate ligament lives in the center of the knee. It's bathed by fluid, so-called synovial fluid, and it doesn't have the healing capacity that the medial collateral ligament does, as that lives outside the knee, deep to the sort of skin and soft tissue structures, but outside the joint.
That's interesting. I've never heard it put that way.
Yeah, and again, as I say, I don't want to get in a rabbit hole.
But that's why the
science.
ACL is more serious than in longer rehab.
Right. You could have what we call a grade 3 medial collateral ligament injury, which means that if we examine the knee, it can open book or gap. If you grab the thigh and pull on the lower leg, you can open it up, and it'll have no stability whatsoever. You could have the same grade 3 injury in the anterior cruciate ligament where you pull on it to make it go forward, and it just translates, and there's no endpoint, and the tibia is unstable relative to the femur, right? One is in the front to back plane, being the ACL. The other's in the side to side plane, being the medial collateral ligament. They could be just as loose, but if you put the MCL in a brace, it will often heal and tighten up. And if you put the ACL in a brace, they will never tighten up. Do you follow me?
Yep.
So they're just totally two different ligaments, but they're so important to understand the differences because we can borrow from that biology and how we understand healing, and we learn so much from that deeper understanding.
Well, let me ask you this. How do you define, then, a sprained ligament?
Well, I mean, I think it's important to understand that a sprain is a tear. People get freaked out. It's only sprained, it's not torn. It's like saying...
A lot of people wouldn't think a sprain is a tear. A tear sounds really serious, Doc.
I get it. It's the same thing as, I'm glad it's fractured, not broken.
Yeah.
Well, I mean, it's the same thing. But, the one is sort of a medical word, one is a layperson's word. A sprain and a tear are the same thing, but people have to understand that not all tears need surgery. Not all tears have a bad prognosis or forward-looking outcome that's negative. So, a sprain is analogous to a tear. Anytime someone sprains their ankle, oh, by the way, you just tore the anterior talofib ligament. You ever heard of it before?
No.
Probably not. But a sprain is a tear of the ligaments. But people tolerate that much better. They can heal. They might be a little bit loose, but they can tolerate having many ankle sprains spread apart and still recover and get back to sport. Not true with the ACL sprain.
Question: can you have a sprained meniscus, or is that the same thing? Then?
No, that would be different. We don't use.
You can only
that
tear a meniscus.
That's correct. Well, again, sprain is a tear, right? But a meniscus tear, we don't use. You
would never say sprained meniscus
because you know why, Steve? We use the word sprain typically for ligaments, and ligaments hold bone to bone. The meniscus can also tear, but we don't call it a sprain because that word is used for a ligament which holds bone to bone. You follow me?
Okay.
So a sprain and a tear are the same thing. But when it's not referring to the ligament, we can call it meniscal tear, but we wouldn't call it necessarily a sprain. That's just not the terminology we use.
Interesting stuff.
Yeah, it's all about the vernacular.